So when I actually present to clients, I always say, well, why did we build outcomes, right? Like, what is it and why did we build it? So if you think about outcomes is allows agencies to optimize towards real KPIs like scripts. So a TRX, NRX, NBRX, as well as audience quality and exposed visits. And if you think about why we created it, there's third-party measurement that lags, and I've experienced it firsthand coming from the agency. So will get a PowerPoint or some information a month out or even a quarter out of the campaign. So the optimization lags. It's not necessarily real time. And if you think about us as the most powerful healthcare marketing platform, we really wanted to enable the optimizations in real time using the most important conversion, right? Scripts. If I'm a pharma company, I want to make sure that I'm optimizing towards scripts rather than maybe some of the front end metrics that most DSPs optimize towards, like a click-through rate or view-through and viewability.
So how does that look like for reporting?
Yeah, so the beauty about our platform is it all sits under one umbrella. So it's the healthcare marketing platform, and we built it on three foundation pillars. So the first one being plan. So we have access to unique data that helps us build custom audiences for HCPs as well as for patients, doing patient modeled audiences. And when we built, our planner tools to be able to create these custom audiences, the biggest benefit was click here to activate, right? It's really important that you're creating these custom audiences with the ability to export it directly into the seat of that advertiser within the DSP. So once the audience is in the DSP, the agencies can activate across all the exchanges. We plugged into many different endemic publishers, as well as buying across connected TV. And the outcomes portion sits all under that umbrella. So the outcomes report is basically within the DSP. And as clients are setting up their campaigns, they could say, for this campaign, if it's a patient campaign for connected TV, I want to turn on the algorithm towards scripts or towards audience quality. So it's a click of a button, and the algorithm actually, the optimization engine takes that algorithm, and we're linking ad exposure to medical and pharmacy claims data in real time. So the algorithm's continuously learning, optimizing towards key KPIs that clients care most about in real time.
Awesome. So, Jen, tell us what else is exciting for you and differentiates Deep Intent, about what you guys are doing, and maybe draw a little bit on your background in the agency world and sort of how you see innovation happening at Deep Intent and what some takeaways are for the industry.
Yeah, so what gets me so excited is not only is it an optimization engine that works in real time, but the ability to use the insights beyond programmatic. So if you think about, pharma agency or pharma clients, right, send agencies, here's who I want to go after. And I actually just wrote a blog and I referenced Mary, right? Mary's a woman, 35 to 54, and she likes to go to the beach and she has RA, right? And there's all this segmentation work that's done. One of the benefits of our platform for outcomes is having the dashboard at your fingertips. And what we're doing is linking ad exposure to medical and pharmacy claims, but we're also linking it to demographic data. So in the platform, we could see of consumers or patients, right, validated patients that actually got on script. So one of the benefits is that the script data is based on filled prescription. So we know that that patient actually went to the pharmacy, picked up the script. Now we're understanding what the demographics are against that patient. Not only demographics in terms of age and gender, but if you think about occupation, household income, life stage, right? Are they, baby boomer? Are they retired? And all a wealth of information. So how do you start to validate client segmentation and learn more about actual patients that are getting on drugs? Another example that I give is creative, right? Creative agencies spend a lot of time coming up with the right messaging as well as the right creative format. So in our platform, you're actually able to see creative placement based on scripts. And the scripts could be, of the people who got on drug, most of them were exposed to 300 by 250, right? Or being able to say this creative unit outperformed another. So when those creative conversations are going on and more money is being spent on new creatives, this could really drive what creatives are being built and with a purpose.